procedure, you will have to explain the steps of procedure to the patient. Okay, yeah, you will counsel the patient, you will explain the entire step to the patient before insertion of tube. You will tell what you're going to do, and this is the first step. Okay, explaining the procedure is the first step, and you take consent. And then the ideal position for doing gastric lavage is left decubitus position with head down by 20 degrees. So why do we prefer left lateral position, left decubitus? So as depicted in the picture, you can see, if you place a patient in the right lateral position, what will happen? The pylorus will lie in the lower side, and this is the tube which you have introduced, and the fluid, gastric lavage fluid you have given. You will see that if you place the patient in the right lateral decubitus, the pyloric emptying is enhanced, and the purpose of gastric lavage is not served. Now, when you place the patient in left lateral position, you will see that the pylorus will lie at a higher position, and this is the tube which you have introduced by orogastric route, and this lavage fluid will lie on the lower side, and you can do the procedure. And the second step, after explaining the patient, you will wear a gown which does not have to be sterile. You will use a clean gown, gloves, and you will measure the length of the tube to be introduced. The length of the tube which needs to be introduced can be measured by measuring the tube from the nose till the tragus, then from the tragus to the xiphoid process. This is the length of the tube to be introduced. So you have to mark the length, total length, okay. But the good part about Ryle's tube is that there are various marking in the tube at 40 centimeters, 50 centimeters, 60, 70, like that. So we can introduce the Ryle's tube up to 50 centimeters from the nose. So after measuring, what you do is, next procedure, you lubricate the tube and you gently insert the tube through the nose and down to the esophagus. Okay, gently you have to introduce till the measured length of the tube is reached. And during the entire procedure, you will ask the patient to swallow, or you can give sips of water if needed. And to confirm that the tube has been placed correctly in the stomach, you can aspirate the content with a 50 cc syringe. You can aspirate the content, and if you can aspirate any content, you can send that for toxicological screening in case of poisoning, or you can push a gust of air with a 50 cc syringe and it will produce a gurgling sound. You have to listen that with a stethoscope. So this will confirm the tube is in the stomach. Now, next procedure is turn the patient. During introduction, you can make the patient lie in the supine position. Especially Ryle's tube, you can make the patient lie in the supine position with neck slightly extended, and you introduce the tube. And during the lavage procedure, you can turn the patient to the left lateral position as I have shown, and you infuse around 200 to 300 ml of normal saline or sterile water into the stomach. And you drain the administered fluid into the dependent irrigation tray, a bucket held adjacent to the bed, or you can aspirate with the help of 50 cc syringe. Now, repeated administration of the fluid has to be done until the content which comes out is clear. So at the end of the procedure, in indicated cases, you can give activated charcoal through the same tube via the Ryle's tube, and the dose of activated charcoal is 1 gram per kg body weight. So now I'd like to show you the video of the procedure of gastric lavage. This is our resident, Dr. Ankan, who is performing the process of introduction of Ryle's tube followed by gastric lavage. He is explaining the entire procedure to the patient, and then you can keep a cut sheet or a clean towel on the chest to prevent contamination or swelling of the chest. So after that, you can wear a sterile or a clean gown. You can prepare yourself by wearing a clean gown. And these are the equipments required. I explained: Ryle's tube, 50 cc syringe, normal saline, and lignocaine jelly. Okay, and adhesive tape. This is the Ryle's tube of various size, and you can mainly use 14 or 18. And this is the IV set through which you can introduce the fluid. After wearing gloves, you need to measure the length of the tube to be introduced. Okay, and you can, after measuring the tube, you can just lubricate the tube after measuring. He is measuring the length of the tube to be introduced from nose till the tragus and till the xiphoid process, and you need to mark the length of the tube to be introduced. So after marking, then you will introduce the tube through the nose. In the entire procedure, you will ask the patient to try to swallow the tube. So slowly and swiftly, the Ryle's tube has been introduced and till the marked level, and now you need to fix the tube with the adhesive tape. First confirm whether it has reached the stomach. Here he is confirming it by pushing a gush of air into the stomach, and the intern is listening with a stethoscope to see whether there is any, to listen whether there is any gurgling sound produced. So this will confirm that the Ryle's tube is in the stomach. During the procedure, if you see that the patient starts coughing, then you need to take out the tube. Sometimes what happens during introduction, instead of going into the esophagus, the tube may be wrongly placed in the respiratory tract. So in that process, the patient will start coughing and you will have to take out the tube immediately. So now he has fixed the tube. Okay, after fixing, you can turn the patient to the left lateral position. The patient is being turned to the left lateral position. So now you can start the procedure of gastric lavage. Here he has taken normal saline and it has been attached to the IV set. So this, what you can do is you can directly give the fluids in jet around the major fluid, that is 200 to 300 ml, using an IV set directly, or you can cut open the normal saline and you can pour the measured amount slowly through the 50 cc syringe. Okay, here he is introducing the fluid through the IV set into the Ryle's tube, and successively after introduction of around 200 ml, you have to aspirate the fluid, or you can turn the patient, or you can allow the fluid to be drained by the gravity into the bucket which is kept just besides the bed. So by gravitational effect it will come out and the fluid has been introduced. This is known as the siphon effect. By siphon effect, the fluid will be introduced into the stomach.